Welcome back, guys. Welcome back to the channel Malik Helps. So the next video is about the systemic lupus erythema, somatoform autonomic dysfunction, amyloidosis, and systemic scleroderma. Hope you will enjoy the video. I want to highlight that although videos are not in the detail, the content is related to only solving the croc questions or who want to get good marks in the croc. So it's just to cover up the concepts which we have missed. So let's start with the topics. So the first thing is systemic lupus erythematosus. So as a definition, it's the chronic autoimmune disease where the body attacks its own healthy tissues and organs. So the parts which will be affected or the systems which will be affected are skin, joints, kidney, brain, heart, lungs. So almost most of the system will be affected. The question profile will always say a lot of systems are affected together. So the symptoms which we will see are fatigue, joint pain and swelling. One of the main symptom is butterfly shaped rash, fever, kidney problem, chest pain, hair loss, and Raynaud phenomenon. Raynaud phenomenon is also seen in systemic scleroderma. I'll explain again, which is simply the fingers and toes starts to turn white or pale, or let's say bluish discoloration of the fingers or the toes. So let's see the questions. For that I have wrote one more thing on the top of it, erythema. So erythema simply means the redness of the skin caused by increased blood flow, kind of hyperemia, in the superficial capillaries, which is a result of inflammation, infection, or some sort of injuries. Let's move to the question. The first patient states that there is a febrile temperature, she have a joint pain, periodical skin rash, steady enhancing of ESR, and the question says LE cells. So whenever the question says LE cells, it already simply means the systemic lupus erythematosus. So mark the answer SLE. Let's move to the next patient. The next patient is 30-year-old, which presents with the body temperatures, small amounts of articulations of the hand, face erythema, edemata and erythema, as I have explained, edemata and erythema. So RBCs are low, hemoglobin is low, WBCs are severely low, ESR is elevated, urine proteins are significant to say glomerulonephritis. So RBCs are also there. So severe hematuria. So the question states a lot of systems are affected. So remember, when there are a lot of systems together are affected or degenerated, remember to mark SLE. Next question. Next patient states that he got the elbow joint pain and dyspnea, weakness, febrile temperature, skin pallor, erythema on the cheeks, ulcerated lip mucosa is ulcerated, joint are not visibly deformed but the movement is restricted, pleural friction, so this is something the same as the rub, sound is detected in the lungs, heart sounds are dull, tachycardia, gallop rhythm, heart rate is elevated, BP is low. So as we can see in the question, again the joints are affected, the lip mucosa is affected, the heart system is affected, the respiration system is affected. So a lot of systems are affected. So the diagnosis will be SLE. In the corner I did it for myself. There was no real question for it, that how do we treat it actually. So since it is an autoimmune disorder, so we need immunosuppressant or glucocorticoids. Here are written some glucocorticoids, or normal body temperature 37, we all know that. Next question. Next patient is also a child, developed the morning fever, cheilitis, stomatitis. Cheilitis is the inflammation of lips and stomatitis is the inflammation of mucous membrane of the mouth. Photosensitivity. So lupus is related to the photosensitivity. The patient feels the photosensitivity. So abnormal skin reaction for the sunlight. If the patient go outside in the sunlight, he will see skin changes immediately after the exposure to the sunlight. Leukocytosis, thrombocytopenia. So also there is a think that anti-nuclear antibodies in a high titer. So since we know that SLE is an autoimmune disorder, so the antibodies are made against the our own DNA itself. So antibodies to anti-nuclear DNA or antibodies to the native DNA, you will see such things in the croc question. Make the diagnosis SLE. Next is somatoform autonomic dysfunction. So it's a condition where the person experiences physical symptoms suggestive of a dysfunction in the autonomic nervous system, but without any identifiable cause in the autonomic nervous system. So what the autonomic nervous system controls is the heart rate, respiration rate, digestion, respiration, perspiration. A lot of things are controlled by the autonomic nervous system, but most of the time we will not be able to find any pathology or the cause of the problem. So let's see the question, you will understand it well. The first patient is a girl, is a child. So she says the periodic pricky pain. I have highlighted the thing that it can be due to stress or anxiety. It's possible. So she feels the periodic pricky pain in the heart region. Percussion revealed no changes in the cardiac borders. So no pathology is really found in the percussion. Auscultation revealed the arrhythmic enhanced heart sounds. The ECG showed sinus rhythm, impaired repolarization, single supraventricular extrasystole, which seems to be normal for us at rest. So diagnosis mark somatoform autonomic dysfunction. So let's move next. Next is amyloidosis. So let's define it. Amyloidosis is group of disease which is characterized by the accumulation of amyloid protein. So the symptoms will occur wherever the amyloid deposits will be there. Let's see what's primary amyloidosis. It is caused by the overproduction of the light chains from the plasma cells, and the secondary amyloidosis is the result of the chronic infection, so or chronic condition, chronic inflammations. So the croc question will always say that there is a blah blah history of this diseases, for example rheumatoid arthritis, some 5 years of chronic rheumatoid arthritis, and now on the background of rheumatoid arthritis, now the patient developed this and this symptoms, amyloidosis. So it is due to accumulation of serum protein amyloid A. Some extra information, hereditary amyloidosis and about the related amyloidosis. Hereditary is caused by the genetic mutation, whereas the dialysis related amyloidosis is caused by the accumulation of beta 2 microglobulin. No need to remember about both of these. And let's move to the symptoms, because I haven't seen any question over hereditary or dialysis related amyloidosis. Let's see the symptoms. So as I told, like wherever the amyloid deposits will be there in the body, the symptoms will be explained through the organ affected or wherever the deposits are there. So if they get deposit in the kidney, we will see proteinuria, edema, renal failure. If you see heart, there will be cardiomegaly, heart failure, arrhythmias. If there is deposits in the nervous system, so neuropathy, numbness, tingling, pain in extremities. If they deposit in the liver, hepatomegaly, liver dysfunction. GI symptoms when they deposit in the GI tract. Skin symptoms, easy bruising, purpura, waxy thickening. No need to remember all of these symptoms. Just remember that the croc question will give you the background of some chronic condition, 5 years of blah blah or 15 years of blah blah, and on the background of that chronic inflammation the patient developed the symptoms related to this and this. Let's see the question for the better understanding. So the first patient is an elderly patient who is suffering from osteomyelitis of femoral bone for 20 years. We got what we needed. The chronic pathology is given in the question. So however, they are also talking about the increase of alpha 2 and gamma 2 globulins. So mark the secondary amyloidosis. So another patient complains about the weakness, leg edema, dyspnea, and he is suffering from chronic bronchitis from many years. So we got our pathology, what we needed to mark the answer as renal amyloidosis. You can pause the video and read the question carefully, but I am just highlighting the keyword to you. The next patient is 46-year-old. Is suffering from rheumatoid arthritis from 20 years history. So this is enough to mark the answer as renal amyloidosis, since we see the background of rheumatoid arthritis, which is chronic, 20 years old history, and now the patient developed proteinuria or wax-like cylinders. As we see, we marked renal amyloidosis. Another patient is suffering from ankylosing spondylitis from 15 years, and he developed this and this symptoms right now. So we gonna mark the renal amyloidosis because we got our chronic pathology as a history to mark the answer renal amyloidosis. Let's move next to the systemic scleroderma, which is a chronic autoimmune disease characterized by the abnormal growth of the connective tissue leading to the skin thickening and internal organ fibrosis. So before I forget to highlight this point, I want to tell you that in the prop question they will also ask that in systemic scleroderma the antibodies in the patient will be against collagen. They ask this question directly, that which antibody against what system the antibodies are made in systemic scleroderma. So mark collagen. In also we can see some symptoms. So the main problem which occurs in systemic scleroderma is simply the skin thickening. So if the person wants to swallow something, his esophagus is thickened out, so he cannot swallow, he got the dysphagia. So if there is a thickening of the skin in the hands, so we cannot move our hands properly. And one favorite keyword for the croc question is amemia. They say amemia is basically the mask-like face. If we got a very thick skin of the face, we cannot smile properly. So let's see the symptoms. Skin tightening, thickening, hardening, shiny. Rayon phenomenon, which is seen in a lot of things. When you see the rayon phenomenon in the question, doesn't have to mark the rayon disease always, because rayon's phenomena is explained in systemic scleroderma as well, and in many more diseases the rayon's phenomena is explained. So be careful until the question says only about the discoloration of the fingers and toes. If there is something else given like anemia and plus blah blah blah, the dysphagia and many more symptoms, most of the time some of my friends has make it like a mistake. They mistaken between the systemic scleroderma and the rayon's disease. So just remember that rayon phenomenon is explained in the systemic scleroderma as well. So let's move next to the questions. A 32-year-old patient having pain in the small joint of the hand and difficult deglutition, suffering from 13 years. The anemia, this is what we needed. Anemia is a lack of expression because of this thick skins. So we have to understand this paresthesia at the tips of the finger. This is what highlights the rayon's phenomenon, that there is a bluish discoloration of the fingers of the hand. Weakness, suffering from 13 years since it is chronic. So shortening of nail bones because the skin got thickened. Skin indurations in the area of the shoulder girdle are present. Basal pneumosclerosis, the patient having a lung system as well, because the collagen of the respiratory system has got thickened out. And esophageal constriction, as I have told you that there is a thickening of the skin in the all the parts of the body. So when there is a thickening of the esophagus, then there is a esophageal constriction as well. So we got the enough point to mark systemic scleroderma. Let's see the next patient. Next patient says about the numbness, paleness of the second and fourth fingers, muscle rigidness, intermittent pulse, and many more things. The main thing we want to see here is mask-like. You can pause the video and read the question twice, no problem. I'm just trying to highlight the questions keyword only because I have lesser time a bit. So solid edemata of the hands, the mask-like itself is which is anemia, is enough to mark the systemic scleroderma. Next patient is having a 6-year history of Raynaud's syndrome. So about this question exactly I was talking about. When we see this Raynaud's syndrome, we don't have to mark in the answer the Raynaud's disease. So let's say they will give more things to diagnose the systemic scleroderma. So 6-year history of Raynaud's syndrome has recently developed pain in the small joint of the hand, difficult movement of food down the esophagus. So all these symptoms appeared because the patient was having before the Raynaud's phenomena. Before maybe it was Raynaud's disease, but now it has progressed as a systemic scleroderma. So, a 35-year-old woman is a polisher who complains of the chills and cold bluish fingerprints and low mobility of her hand, contracted sensation in the skin of face and hands. This is anemia. Maybe I have written it wrong, but this is anemia, which is mask-like face, pouch-like pursing of the mouth, thick skin of cheeks and hands. So we got whatever we needed for marking the systemic scleroderma. So this is it with this video. I hope you enjoyed this video. Comment me in the comment box if you want me to explain something else from this video, and highlight your mistakes. Let me know in the comment. Wait for the next video. Thank you so much.